Welcome to this explainer. You know, when you sign up for Medicare, you're literally facing one of the biggest healthcare decisions of your life. And the crazy thing, most people make it without the information they actually need. So, do you go with Original Medicare, that traditional government program, or do you choose Medicare Advantage, the private insurance plan that promises all those shiny extras like dental and vision? Look, both have very real benefits, and both have very real drawbacks. The right answer? It's completely different depending on your unique situation. So today, I'm going to lay out both sides for you, clearly and honestly, so you can decide for yourself. Absolutely no pressure, and definitely no sales pitch.
Here's exactly what we're going to cover today. First, how Original Medicare works and who it's really best for. Second, how Medicare Advantage works and what it actually brings to the table. Third, we'll do a direct side-by-side comparison of the two. And fourth, I'll give you 3 crucial questions that'll help you decide which path is right for you. Let's just dive right into Original Medicare.
Section 1. Original Medicare Explained.
So, Original Medicare. This is the traditional federal health insurance program, the exact one the government has been running since way back in 1965. It's neatly divided into 2 main parts. You've got Part A, which covers your hospital stays, skilled nursing care, and hospice. And the good news here is that for most people, Part A doesn't have a monthly premium at all. Then there's Part B. Part B covers your everyday stuff: doctor visits, outpatient care, lab tests, and medical equipment.
Now, Part B does come with a cost. For most folks, there's a monthly premium, which sits right around $174 a month in 2025. It's just a foundational cost you've really got to factor into your retirement budget.
But here is the absolute biggest advantage of Original Medicare: total freedom. Seriously, you can see virtually any doctor or specialist in the entire country who accepts Medicare. And get this, about 93% of all doctors do. There are no networks, you don't need any referrals, and there's no prior authorization needed before most procedures. You literally just go to the doctor, Medicare pays its share, and that's it. It's really that straightforward.
But, of course, there's a catch. The main disadvantage? Uncapped cost exposure. You see, Original Medicare does not have an out-of-pocket maximum. So, heaven forbid, if you face a serious illness and need extensive treatment, those bills can add up incredibly fast. There is simply no cap to stop the bleeding.
And that uncapped risk is exactly why so many people on Original Medicare end up buying a Medigap supplement plan. It literally fills in those gaps and puts a hard cap on your annual expenses. We actually have a full explainer coming out specifically on Medigap, so keep an eye out for the link in the description for that one.
All right, moving right along to Section 2, Medicare Advantage Explained.
Now, Medicare Advantage, which is also known as Part C, is a completely different approach. Instead of the government paying your medical bills directly, they actually pay a private insurance company like Humana, Aetna, or United Healthcare to cover your benefits for them. And honestly, the appeal here is very genuine. A lot of these Advantage plans have incredibly low or even zero monthly premiums on top of your standard Part B cost. Plus, they throw in all these sweet extras that Original Medicare just doesn't touch. We're talking dental, vision, hearing, maybe even a free gym membership. And a huge perk, they actually come with a built-in annual out-of-pocket maximum. The second you hit that cap, the plan swoops in and covers 100% of your covered costs for the rest of the year.
But, and there's always a but, right? Here is the crucial trade-off. You are locked into a network. You have to use the doctors and hospitals that are specifically in your plan's network to get the best rates and in some cases to get any coverage at all.
On top of that, some Advantage plans actually require you to get a referral from your primary care doctor before you can even step foot inside a specialist's office. And many of these plans require something called prior authorization. That means the insurance company itself has to sign off and approve certain medical procedures before you can actually get them done.
So, why does all this matter? Well, think about it. If you're someone who travels a lot, or if you get treated at major medical centers, or especially if you have complex, ongoing health conditions that require a whole team of specialists, man, those network restrictions and prior authorizations can suddenly become a massive roadblock for your healthcare.
Which brings us perfectly into Section 3, a side-by-side comparison. Let's just step back and put these 2 fundamentally different approaches right next to each other so you can see the showdown clearly. On one side, Original Medicare. You get incredible nationwide freedom. Any doctor, no networks, but there's no out-of-pocket maximum, so you usually need a Medigap plan, and you get zero dental or vision perks. On the other side, Medicare Advantage. You get cost caps and some really nice extra perks, but you're restricted to a specific network, and you often have to deal with those prior approvals. Neither option is universally better. They're just totally different tools designed for different needs.
Let's wrap it up with Section 4, how to actually choose.
All right, so how on earth do you make this decision? I want you to ask yourself 3 critical questions right now. Question 1. Do I have doctors I absolutely positively want to keep? If the answer is yes, before you sign a single piece of paper, call those doctors' offices and ask them directly if they accept the specific Medicare Advantage plan you're looking at. Seriously, do not just assume. Network participation changes every single year.
Question 2. Do I have complex or ongoing health conditions that require major procedures or multiple specialists? If you do, that incredible freedom Original Medicare gives you, the ability to see any doctor anywhere without begging for a referral, might be worth way more to you than a free gym membership or some extra dental benefits.
And finally, question 3. What is my actual budget? Look, if a low or zero premium Advantage plan is literally the only realistic option for your finances, then that can absolutely be the right choice for you. Just make sure you go into it fully informed, with your eyes wide open about those network rules and prior authorization hoops. Like I said at the very beginning, the right answer is completely different depending on your situation. So, knowing the amazing nationwide freedom of Original Medicare on one hand and the capped costs and sweet perks of Medicare Advantage on the other, which path is going to give you the total peace of mind you need for your healthcare future? Take your time and think carefully about what matters most to your health and your wallet. If you found this explainer helpful, please hit that subscribe button, ring the bell, and I'll see you right back here next week.